everyone, Amanda Williams here with you again today. But today I have something really unique to talk to you about. When it comes to our immune system, oftentimes we think of the common things. We think of things like vitamin C, vitamin D, and zinc, which is great because we know how important those nutrients are when it comes to both our innate and our adaptive immune system. But sometimes we overlook the role of other things in the body that really play an integral role in maintaining our health on so many different levels. And this is something that I enjoy talking about because I am a big fan of immunology and understanding the way that the body's chemical messengers are working to maintain our health. And oftentimes when we use the word chemical messenger, we forget that we are now talking about hormones. And there's one really important hormone when it comes to our immune system, and that is DHEA. Now, DHEA should not be confused with the omega-3 fatty acid known as DHA. You know, we get DHA from things like fish oil or krill oil. DHEA, on the other hand, this is an adrenal hormone. And our adrenal glands are these small glands that sit on top of our kidneys. And this is where all of our stress response can come from. So when we think of things like cortisol, oftentimes when people think of their stress hormone, they recognize cortisol as being that main functional player. But they oftentimes don't understand the role that DHEA actually plays. And when we have excess stress in the body, this can hinder the proper functioning of that other crucial and very important hormone known as DHEA. And I talk about this on many different realms when we think about our health. We can look at a diabetic, for example, who can have higher stress in the body, hence higher cortisol, which can then lead to a depression in DHEA. And once we depress DHEA levels, we are now opening up this door to a potential immune system dampening. We don't want that to happen. Now, DHEA, which actually is dehydroepiandrosterone, if you really want the full technical name of it, most people just shorten it up with DHEA. It's much easier. This is something that I encourage people all of the time. Anyone who's talked to me in person or by phone or via email knows that I am a huge advocate of comprehensive blood testing. And in that comprehensive blood testing, I always encourage people to have their DHEA sulfate level assessed. So on a blood test, it's DHEA with a small little s behind it. So the S is for sulfate. This is actually going to tell you your level of that circulating chemical messenger, that hormone, in your body. And this is important for so many different functions. So when we think about maintaining healthy blood sugar, as I mentioned, if we have excess cortisol, that can now impede the proper function and release of insulin. And this can all happen because we don't have adequate DHEA. We know that the American Heart Association published a study in the journal called Stroke that indicated that women who had lower serum DHEA sulfate levels had a greater likelihood of having an ischemic stroke. We also know that men have been linked to low DHEA levels and higher risk for cardiovascular disease. So we know that DHEA is playing this critical role. And during this time, you're probably not going to go out and have your DHEA level tested, and that's understandable. But when it comes to supplementation with DHEA, people often want to know, well, why would I be taking it? And what benefit would it be for me to have DHEA in my routine? Well, I'm going to go through some of those different things. Number one, when it comes to our immune system, we know that DHEA is playing a really key role in the innate immune system. So when we think about the initial response from when we're exposed to something such as a virus or a bacteria, we know that that chemical messenger, that DHEA, is playing an integral role with our natural killer cells. And if we do not have adequate DHEA, we can see an exacerbation or overabundance of inflammatory cytokines being developed in the body. And we see this even in studies with asthmatics, where they've been able to see that asthmatics are more prone to exacerbations of an asthmatic episode when their serum DHEA levels are low. So we know for sure that DHEA is controlling immune function, especially that initial immune response. So this is why we definitely want to make sure that in the future we have our DHEA sulfate levels tested. Now, this matters for cardiovascular health. This matters for maintaining healthy blood glucose, but this also certainly makes a difference when we look at things like maintaining muscle mass. And when we think about age-related muscle mass loss, known as sarcopenia, if we experience sarcopenia, we're basically losing our muscle mass, which weakens the underlying skeleton, which leaves us more prone to a potential fall. And in that type of a situation, that's never a good thing if someone falls and breaks a hip. So DHEA levels and knowing what your level is can mean so much because remember, it's a chemical messenger. It's sending signals out throughout the entire body to provide crucial response to so many different functions. And we know this from enough clinical research done on DHEA. So when it comes to supplementation, people will ask, how much should I take? And without knowing what your serum level is, we do know that as we get older, we do not produce as much DHEA. So that's just a given. Now, the main thing is how much? Well, here's the answer to that. I generally advise for women, it's somewhere around 15 to 25 milligrams of DHEA per day. Now, I always advise that once you start to supplement with DHEA, that you would have your serum levels tested maybe in about 8 weeks. And let's see where you're at, and you can make any modifications from that point on. For men, generally speaking, anywhere from 50 to 100 milligrams per day, just depending upon how low your levels are. But 50 milligrams is usually a fairly consistent amount for people to be supplementing with. Now, during times when the body is under extreme stress, whether that be emotional or physical, it would be advantageous to consider DHEA because we know that your cortisol is hammering down your DHEA level. And the more that DHEA level goes down, the greater likelihood your immune system is going to have a delayed response in fending off viruses and bacteria. We don't want to leave that door open, which is why I'm coming to you every day to talk to you about all of the different things that you can be doing to optimize your immune defenses. And DHEA to me is a really critical component to that. So I certainly encourage you to check out DHEA on our website. You can certainly reach out to me if you have specific questions. Sometimes people do because they're curious, like, okay, so this is a hormone. How exactly is this working? I am always here to answer your questions in detail. Remember, our stores are open. We have curbside pickup available for you for your convenience, as well as the ability for you to access via our video chat, our regular web chat, and you can always email us at nutritionist@inlighthealth.com. I will be back with you guys tomorrow to talk about more nutrients that can be beneficial for your immune system. So tune in tomorrow at 11 a.m. Thank you so much.